Hello everyone, I'm Dr. Meera Raghavan, a senior consultant urogynecologist and robotic surgeon. I consult at Apollo OMR Perungudi as well as at Apollo Hospital's Greaves Lane. Topic for discussion now is going to be stress urinary incontinence, which happens in females more so compared to the males. Now, what is stress urinary incontinence? Women do complain of involuntary leakage of urine when they cough, sneeze, laugh, exercise, or do sudden jerky movements, or even during sexual activity. Such is an embarrassing symptom, and women do not come forward voluntarily when they suffer with the problem. So they suffer in silence for a long time for a problem which could be completely cured or controlled, and this affects their quality of life significantly. Not only it's a hygiene issue, it leaves a deep psychological impact on these patients, enabling them to exclude themselves from social activity as well as socializing in general because of the personal embarrassment they face. Now, generally, women in the ester years or generation did not go out that much, so probably reconciled to the fact this is a part of aging and menopause and did not voluntarily come out with this problem. However, with the growing pandemic of overweight in women, especially in India, as well as the increased incidence of diabetes and women being more active till their 70s or 80s and being quite socially aware, these problems have been coming up to the surface, and women are seeking not only advice regarding these problems but also curative treatments. Now, why does this happen? Stress urinary incontinence happens because of the poor integrity and strength of the pelvic floor muscle which support the bladder neck and the under part of the bladder. Now, this happens either because of repeated vaginal deliveries, women being overweight, uncontrolled diabetes, or a manual labor which needs lifting of heavy weights, and menopause adds insult to the injury. So, there is a worsening of the stress leak whenever such a physical activity is undertaken, whereby the abdominal pressure or the pressure in the tummy increases. Pelvic floor exercises or Kegel exercises go a long way to improve the strength and the coordination of the pelvic floor muscles, thereby preventing the stress urinary incontinence or preventing the worsening of the stress urinary incontinence as age advances. If patients do this regularly, every day, twice a day, lifelong, then we can prevent such occurrences. Say if somebody has already developed, we usually put them on a 6 weeks regime of this pelvic floor exercises, and should they not get better, we do advise them surgery. Now, what does this surgery entail? It entails placing a tape underneath the bladder neck which tightens up the area and acts like a hammock and scaffolding so that the bladder neck and the under part of the bladder is well supported. So, whenever the patient coughs, sneezes or laughs, this provides the extra tensile strength to the under part of the bladder and the patient stops leaking. Such patients should avoid lifting weights as a lifestyle measure and also try and optimize their weight and control their diabetes better to get the benefit 100% of the surgery. So, stress urinary incontinence is not something to be ashamed of. It is treatable, it's curable, it's preventable. Thank you.